Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. Welcome to Monday Health Minutes with Valley Health. Summer is here and lots of people are headed outside. And as we go outside to hike and camp and garden, we can come across some ticks, and ticks can bring various diseases with them. So how can you protect yourself from the risk of ticks? We're talking with nurse practitioner Montana Wamsley out of Valley Health Apple Grove about that today. Thank you so much for being here.
Yeah, thanks for having me.
Ticks are very unpleasant to even think about. But what kind of ticks do we have in our area that people need to watch for?
So there's three main types of ticks. You have the common names are the dog ticks, the deer ticks, and the Lone Star ticks. So those are the three most prevalent ticks in this area.
Which ones are the most concerning or disease carrying, and how can we figure out which one is which?
Yeah, so one good way to identify ticks, obviously if you can collect it, bring it in a bag and take it to your local healthcare provider, they can usually identify those. But to do it yourself, a few things you look for: the color and the pattern on the back of the tick. So the Lone Star ticks are the easy one. They have the little whitish dot on them. The female adult Lone Star ticks have the dot. The other ticks, such as the dog tick and the deer tick, a little bit harder. The dog tick has kind of a whitish pattern on the back of it, and then the deer tick is more of a solid dark color.
Okay. Do they all carry diseases or just some of them?
They all carry diseases. They don't all carry the same diseases. So the big thing people think about, the two big ones are Lyme disease and then more recently the alpha-gal syndrome type situations people can run into. For Lyme disease, the deer ticks are the most concerning, the biggest carriers for those. Those are just the solid colored ticks. For the alpha-gal syndromes, those are the Lone Star ticks that normally contribute to that kind of situation.
And what is alpha-gal?
So alpha-gal actually is a molecule that we find in animals that give us red meat. So normally like mammalian animals like cattle, stuff of that, steak, ground beef, you can get that. The molecule itself is not produced in humans. However, when we consume it in a normal situation, we don't have any problems. However, when you come into contact with a tick that can actually change the way we view alpha-gal on a molecular level, we can see that as a threat, as like an allergen, and then the body starts attacking it and it mounts an immune response that can lead to like anaphylaxis. So every time you eat red meat, or sometimes you can have actually anaphylaxis, swelling in your mouth, your tongue, have to go to the emergency department, get epinephrine, stuff of that nature.
Okay.
So it can be severe.
Yeah, that can be severe for sure. So we
Yes.
definitely need to watch out for that. For Lyme disease, for the deer ticks, what kind of symptoms come along with that?
So Lyme disease initially is kind of vague symptoms. You can get some muscle pains, some joint pains, some kind of neurological stuff such as headache, neck stiffness, confusion. You may get some just general constitutional symptoms such as fever, chills, fatigue, maybe even some nausea, vomiting, decreased appetite. One of the big things we look for is a rash. It's like EM or a bullseye rash. You can see that sometimes as well.
So if you get bit by a tick, how long do you have? Is it instantaneous that you get exposed to these diseases, or is there a window where you're okay?
So generally, in terms of most of these diseases, it's not going to be instantaneous. In particular, Lyme disease, usually you have to have a tick attached to you for at least 8, probably 24 hours or more. So getting those ticks off as quick as possible is the best solution to prevent that.
So when you're outside, come inside, do your tick check.
Yes, exactly. Yeah. A lot of times I'll tell patients when they come inside from being out, outdoors where there could be a high tick load, come in, strip down, put your clothes in the dryer actually, and turn the dryer on high heat. That'll kill them. So you don't have them run around the house. And
So don't wash them, dry them.
Dry them first, yeah.
Okay.
And then get into the shower, wash everything off, and then if you have somebody with you, you could do like a partner tick check, or if you're by yourself, a handheld mirror is good to use to visualize those hard to see areas.
Yeah, because they get a lot of places.
Yes,
that's for sure.
they do.
Let's talk about tick repellents and clothing. How
Okay.
can you best diminish your chances of getting a tick bite?
So the two big chemical repellents we have are DEET and permethrin. DEET is good to use on the skin or the clothes. Permethrin is only for clothes, so don't put that on your skin. But you can do that prophylactically, so before you would go into contact with potential tick habitat. Other types of protective barriers, of course, clothing, don't go into the deep woods with shorts and t-shirt on, preferably. Other things you can do would be just avoid highly vegetated, thick brush areas. They like to tend to hang out in those areas.
So stay on the main path, long shirt, long pants, and use your DEET.
Yes.
Okay, great advice. Stay tick-free this summer. Enjoy the outdoors without all that risk.
Exactly.
Montana, thank you so much. We appreciate your help.
Of course, thank you.
Thanks for checking in on Monday Health Minutes.